Inpatient coding is crucial in healthcare. It serves as the backbone of the medical billing process, ensuring that every diagnosis and procedure is accurately documented. It involves assigning specific codes to diagnoses and procedures, which are standardized across the healthcare industry. These codes are used for billing, research, and tracking healthcare trends. They help in creating a comprehensive picture of patient care and outcomes. Inpatient coding focuses on patients admitted to a hospital. This includes everything from the initial diagnosis to the treatments and procedures performed during their stay. This differs from outpatient coding, which applies to services given without an overnight stay. Outpatient coding covers routine checkups, minor procedures, and follow-up visits. Inpatient coding ensures accurate records of patient care. This accuracy is essential for maintaining the integrity of patient histories and for future medical reference. This accuracy is vital for hospitals to receive proper reimbursement from insurance companies. Without precise coding, hospitals could face financial discrepancies and delays in payment. It also helps researchers study disease patterns and develop better treatments. Accurate data allows for more effective public health strategies and medical advancements. Inpatient coding plays a vital role in the healthcare system. It not only supports the financial health of medical institutions, but also contributes to the overall quality of patient care and medical research. The principal diagnosis is the primary reason for a patient's admission. It's determined after studying medical records, including doctor's notes and test results. Accurately identifying the principal diagnosis is essential for proper coding and billing. The principal diagnosis determines the DRG, or diagnosis-related group, assignment. DRGs are how hospitals are reimbursed for inpatient care. Each DRG has a set payment rate based on the average resources used to treat patients within that group. The principal diagnosis drives reimbursement in inpatient coding. Inpatient medical facilities provide a wide range of services. These facilities include hospitals, rehabilitation centers, and long-term care facilities. Each facility type has its own set of coding guidelines. Coders must be familiar with these variations. Hospitals offer a wide array of services, from emergency care to surgery. Rehabilitation centers focus on helping patients regain function after an illness or injury. Long-term care facilities provide ongoing care for those who can't live independently. Accurate coding is essential in all these settings. Inpatient coders are essential members of the healthcare team. They review patient records and assign appropriate codes. These codes reflect the patient's diagnoses, procedures, and overall care. Accuracy is paramount in their work. Coders use their knowledge of medical terminology, anatomy, and coding guidelines. They must stay updated on changes in coding systems and regulations. Their work impacts patient care, hospital revenue, and public health data. The role of an inpatient coder is both challenging and rewarding. Section 5. Navigating the language of inpatient coding. Inpatient coding is a specialized field that requires a deep understanding of medical terminology and coding guidelines. It involves translating complex medical information into standardized codes used for billing and documentation. Understanding key terms is crucial in inpatient coding. These terms form the foundation of accurate and effective coding practices. Without a solid grasp of these terms, coders may struggle to accurately represent a patient's medical history and treatment. A diagnosis is a determination of a patient's illness or condition. It is the starting point for all coding activities. Accurate diagnosis coding ensures that the patient's condition is correctly documented and that appropriate treatment plans are developed. POA indicators clarify if a condition was present on admission or developed later. This distinction is important for quality reporting and reimbursement purposes. Knowing whether a condition was present on admission can impact the patient's treatment plan and hospital's performance metrics. Admission diagnosis is the initial reason for a patient's hospitalization. It sets the stage for the patient's care journey and helps healthcare providers prioritize treatment. Accurate coding of the admission diagnosis is essential for proper patient management and resource allocation. Secondary diagnoses are conditions that coexist with the principal diagnosis. These additional conditions can affect the patient's treatment and outcomes. Properly coding secondary diagnoses ensures a comprehensive view of the patient's health status. Comorbidity refers to the presence of two or more conditions at the same time. Comorbidities can complicate treatment and recovery, making accurate coding even more critical. Understanding and documenting comorbidities helps in creating effective treatment plans and improving patient outcomes. A complication is a new health problem that arises during a hospital stay. Complications can significantly impact a patient's recovery and length of stay. Identifying and coding complications accurately is vital for patient safety and hospital performance evaluation. These terms are essential for accurate coding and understanding patient care. Mastery of inpatient coding language ensures that healthcare providers can deliver high-quality care and that hospitals can receive appropriate reimbursement for services rendered. Continuous education and practice are key to staying proficient in this ever-evolving field. Section 6. Real-world applications illustrating inpatient coding concepts. Let's consider a patient admitted for a heart attack. During their stay, they develop pneumonia. The heart attack is the principal diagnosis, while pneumonia is a complication. This distinction impacts coding and reimbursement. Another example is a patient admitted for a hip fracture after a fall. They also have diabetes. The hip fracture is the principal diagnosis, while diabetes is a comorbidity. Understanding these distinctions is vital for accurate inpatient coding. Section 7. The importance of accuracy in inpatient coding. Accurate inpatient coding is crucial for several reasons. It ensures proper reimbursement from insurance companies. It maintains the integrity of healthcare data used for research. Errors in coding can lead to claim denials and inaccurate health statistics. Accurate coding also impacts patient care. Incorrect codes can lead to delays in treatment or inappropriate care plans. Inpatient coders play a vital role in ensuring the quality and efficiency of healthcare delivery. Section 8. The impact of technology on inpatient coding. In this section, we will explore how modern advancements are reshaping the landscape of inpatient coding, making it more efficient and accurate. Technology is transforming inpatient coding in unprecedented ways. The integration of sophisticated software and digital tools is revolutionizing how medical data is processed and coded. Electronic health records, or EHRs, have streamlined the coding process significantly. By digitizing patient information, EHRs allow for quicker access and more organized data management, reducing the time spent on manual entry. Computer-assisted coding, or CAC software, uses advanced algorithms to suggest codes based on clinical documentation. This technology not only speeds up the coding process, but also helps in identifying the most accurate codes, minimizing errors. These advancements improve efficiency and accuracy, allowing healthcare professionals to focus more on patient care rather than administrative tasks. The automation of routine coding tasks ensures that the coding is done swiftly and correctly. However, technology also presents challenges. The rapid pace of technological change means that coders must continuously update their skills and knowledge to keep up with new software and coding standards. Coders need to adapt to new software and coding updates. This often involves extensive training and a willingness to learn and adapt to new systems and processes. They must develop skills to interpret data and ensure the accuracy of automated suggestions. This requires a deep understanding of both the technology and the medical coding guidelines to verify that the automated codes are correct. The future of inpatient coding involves embracing technology while maintaining human expertise. By combining the precision of automated systems with the critical thinking and experience of human coders, the healthcare industry can achieve the best outcomes in medical coding. Section 9. The evolving landscape of inpatient coding. Inpatient coding is constantly evolving. New technologies, regulations, and coding systems emerge regularly. Coders must engage in continuing education to stay current. Professional organizations offer certifications and training programs. The transition to ICD-11, the latest version of the International Classification of Diseases, presents both opportunities and challenges. Coders need to be prepared for these changes and their impact on healthcare data. Staying informed is crucial in this dynamic field. Section 10. Continuing education. Staying ahead in inpatient coding. Continuing education is essential for inpatient coders. It allows them to stay updated on coding guidelines, industry best practices, and new technologies. Professional development opportunities include workshops, online courses, and industry conferences. AHIMA certifications, such as the Registered Health Information Technician, or RHIT, and Certified Coding Specialist, or CCS, demonstrate expertise and enhance career prospects. By investing in their professional development, inpatient coders can excel in their roles and contribute to the advancement of healthcare. Section 11. Inpatient coding, a rewarding career in healthcare. Inpatient coding offers a rewarding career path for those passionate about healthcare. It combines analytical skills, medical knowledge, and attention to detail. Coders play a critical role in ensuring the financial health of healthcare facilities and the accuracy of health data. As the healthcare industry continues to grow, the demand for skilled, inpatient coders will remain high. For those seeking a challenging and fulfilling career that makes a real difference, inpatient coding is an excellent choice.